Hi, good morning. Thank you, everybody. We'll open up in prayer. Father God, Creator, grandmothers, grandfathers, we ask that you sit with us today to guide us with the work that we're about to embark on. We ask for guidance. We ask for strength. We ask that you watch over those fighting COVID and support their families. We ask that you watch over the travelers that they may get home safely. And special blessings for our family who support us in the background, for their strength, for the work that we are doing for the betterment of our communities. In Jesus' name I pray, amen. Thank you, and welcome. We are here from 10:30 till noon. Just give me a quick wave if you're just stepping away from your monitor for a moment, if you're called away or need to take care of some personal business. I will be turning my camera off during the presentation, but I'm still here because I'm fidgeting around in the background here. And welcome, good morning to today's wellness webinar hosted by First Nations Health Directors Association. I am meeting here on the Tsimshian territory, the traditional territories to which I live and breathe. I'm joining you from Kitsum-Kalem. We are located 3 kilometers from the city of Terrace. My name's Charlene Webb. I'm the health director for Kitsum-Kalem. I became a FNHDA member in September 2013 and have served on the board since January 2020 as the Northwest representative for the Northern region. Today, we are welcomed with the presence of John, FNHA Manager of Virtual Health and Wellness Services, and Laura, FNHA Senior Specialist Mental Health and Substance Use Care. I'm very excited to learn from the FNHA Virtual Substance Use. This team provides individuals with access to specialized and addiction medicine, as well as mental health and wellness care coordination. This is in reference referral-based services and is available to First Nations people and their family members living in BC, including family members who are not Indigenous. At this time, I'd like to turn this meeting over to John and Laura, and welcome everybody.
Great, thanks Charlene, and good morning everybody. It's nice to see everybody here. I'm just scanning the list of folks and just some throwback to some great names and great team members that I worked alongside in some previous work. So great to see everybody here. My name is John Rabeneck. I'm Coast Salish from the Snuneymuxw First Nation on my mother's side and English and Irish on my father's side. I'm coming to you today from the beautiful Sayot territory in the Greater Victoria area. And I work here at the First Nations Health Authority as the manager of virtual services. So we'll present today the 2 programs, our Doctor of the Day and the Substance Use and Psychiatry programs for you today to sort of give an overview and answer some questions about the 2 virtual programs. So I'm joined today by one of our amazing care coordinators, Laura, and I'll just allow her to introduce herself and dovetail into the presentation.
Thank you, John. Thank you so much, Charlene, for that opening prayer and for grounding us so that we can have really good conversations today. My name is Laura. I am an uninvited settler on these lands. I'm originally from Colombia in South America, and I came to Canada when I was 16 years old. And my whole career has been devoted to serving Indigenous communities. I feel very close to home when I'm working alongside the communities, and I'm very grateful to be in this role today and to be talking to you today about our program. And yeah, we're very grateful that we know how busy you are, and so we're very grateful that you're here with us today. And yeah, hopefully we can have a really awesome conversation about our program and how to support the work that you do in your communities. Thank you.
That's great. Thanks, Laura. And so I'll just get, we have a bit of a prepared presentation that we've gone through with a few groups, recognizing this, this audience and this familiarity with FNHDA. We might gloss over a few of the first few slides, but for context, they'll be in the PDF when we send them out afterwards. And for people who have any questions or anything, please feel free to jump in and stop us and ask as you will. So I'm just going to go share screen here. Hopefully this will work out. Can folks see that there? Is that good? Yeah. Great. So a bit of an overview today. We've done our introduction piece here. We'll give some context very briefly on the FNHA side of the work that we've done in virtual services, provide an overview of those virtual services, as well as some of the key roles in these programs. So our medical office assistant and our mental health care coordinator, who's also Laura here. And near the end of the presentation, we'll open it up for any questions, any dialogue that you may want to have. We'll be here for the hour, so happy to answer any questions. And so, again, with the context of FNHA, folks may recognize the wellness wheel here. With the vision of healthy, self-determining, and vibrant BC First Nations children, families, and communities is sort of how this work was rooted and where we came from. So the primary care design and delivery is rooted in an approach of culturally safe primary care with high quality and relevant care closer to home, with a transformation of primary care through active implementation of the Declaration of the Rights of Indigenous Peoples, and really having that First Nations-led design and delivery approach with primary care. We'll get into some of the aspects of cultural safety and humility and how that's integrated into our work. But I thought that just gives us a starting point, at least, with where we're coming from. That's you, Laura.
Thank you, John. So really our DoD program started because of the need of creating something for the communities. We are all well aware of the dual public health emergencies with the overdose crisis and the pandemic, and how these two have had an impact in our lives, our families, our communities, specifically on BC First Nations peoples and communities. So early in the pandemic, healthcare operators and support services in a number of communities were closed. And since then, since the beginning of the pandemic, most of them have started to reopen a little bit, but there's a lot of restriction around that. So with the pandemic and the overdose crisis, there was an urgent response. On April 1st, FNHA launched the First Nations Virtual Doctor of the Day program to provide support to First Nations people living in BC who were not able to access primary care. So in 2020, it was a really difficult year, right? We have, again, the pandemic, the overdose. And then we're starting to notice that a lot of people that were accessing our DoD, our primary services, were really impacted in terms of their mental health, access to psychiatry, and access to substance use services. So FNHA decided to create a program from the program to be specific and really specialized on substance use and psychiatry and mental health supports. And so on August 17th, we launched the FNHA Virtual Substance Use and Psychiatry Program, which focuses on supporting individuals with their mental health, substance use, and psychiatry. Next, please. Thank you, John. So this is just a bit, we will go a little bit more in depth, but just to give you a little bit of an overview of our program. So on the left side, you have the First Nations Virtual Doctor of the Day. And this is a primary care service. It has family practice GPs, family physicians. And then to access the program, anyone can call the program. We are open 7 days a week, and we have a 1-800 number. You don't have to be a professional. You don't have to be a referral agent. You can just be a member of community or a family member. And again, this was launched in April 2020 because of the concerns with the dual pandemic that we were experiencing. On the right side, we have the psychiatry service. So this is a specialty service It has addiction medicine and psychiatry doctors. And for this program, you do need to access through a referral agent or a professional in community. It's open 5 days a week, Monday to Friday. And the doctors prefer to meet with the patients over Zoom versus phone. And it was launched in 2020. So for the virtual program, the Doctor of the Day, we are really flexible in meeting people where they're at, really working with the communities. We've worked with some community centers to really kind of connect people to the technology that they needed to access this program. So with DOD, Doctor of the Day, we're able to meet over the phone, try to do Zoom links, try to do email, whatever we need to do to connect with the family. With the specialty service, we're also able to do that, but the first appointments, the doctors do really like to see the patient over Zoom, just to see their presentation and just, because it's a specialty program. And just a reminder that both services are available to all Indigenous people and their families living in BC, including those families, members that are not Indigenous. Thank you.
I think Erica, did you have your hand up there?
Oh, sorry. Thank you, John, if you can, because I'm only looking at the screen. Yes, Erica.
Hi,
Hi.
I'm Ahila. My name's Erica, Health Director for Gitwangach. It
Erica.
says referral from any health and wellness. Does that include NADAP workers and health directors?
Absolutely, yes.
Okay.
So you are a professional in community, you can definitely access this service and just send a referral directly to psychiatry. When you send a referral to psychiatry, one of the care coordinators, like myself, there are other 2 care coordinators, we will meet with you and we will talk to you a little bit about, the patient, what is needed, and then we can create a plan to support them. Sometimes psychiatry is not the best route to support the patient, but sometimes it is. And so we want to walk alongside you to support you in accessing the program. And this includes elders too, right? So we see, obviously, we uphold elder knowledge really high. And so an elder can also make a referral to this psychiatry program.
Okay, and then is there an email attached to accessing this specific service, or is it just the phone number?
Absolutely. So we have an email and we have a fax number. So I will provide you with all of that towards the end.
Okay.
We do have a PDF that we will send to everyone at the end of this presentation, and it will have all of that information as well, so that you're able to complete your referrals and send them to us.
Perfect. Thank you.
Thank you, Erica, for your question. Sorry, John, and if you can help me kind of just monitor the chat, and thank you. Okay, perfect. So we're kind of talking about both programs and just knowing that DOD came first, and then, building from that, we had the substance use program. To tell you a little bit more about DOD, so the purpose of DOD is to really meet clients where they're at. So our unique approach to bridge gaps in services includes appointment conducted over phone, over Zoom, and we really work around accessing technology for clients, even if they don't have a phone. So really it's to create, to reduce those barriers that a lot of people face, especially in rural communities, to access primary care. We want to do it in a way that is safe, in a way that is culturally safe, and that people feel heard and helped and uplifted by our programs. We really want to establish key partnerships that promote innovation and that really kind of bring transformation to the healthcare that we're providing. So in order to do that, we have a team of individuals, of professionals that really kind of make that happen. One of them being our MOAs. So sorry, can you do the next slide, please? Thank you. So our MOAs are the first point of contact with our clinic or a program. They are the safe first point. They are the people that communities, families will call first. And these are wonderful people that can spend between 5 minutes to like an hour on the phone with the patient, really understanding the need and really operating from a strengths-based approach. So really highlighting all the strengths that they bring and how they've been able to take care of themselves their whole lives, and how we can enhance that, and how we we operate from that strength space. So aside from that, from just kind of being the safe first point of contact, they're responsible for booking appointments, connecting with patients, and really creating that safe space to access primary care and to continue building on that. So they will connect with care coordinators if they need more support, or they can help the client navigate those first initial points of contact. So that's with the medical office assistant and with DoD. With the VSAPS program, sorry, next slide. Thank you, John. With First Nations Virtual Substance Use Program. So this, again, is virtually delivered, culturally safe substance use that really kind of includes specialty program services. So assessments, case planning, treatment, follow-up. For addiction, so you have family physicians that are specialized in addictions. They can provide a bit of follow-up, and they can provide short-term consultation for psychiatry. And then this addiction piece is really meant to work very, very close with the client's circle of care. So we always identify who's working with the client. That's why it's so important that a referral comes from a professional, because we always want to bring the care back to the community and work alongside the circle of care. And this program, both of the programs are not crisis-based, right? So we do try to respond in a very appropriate manner and timely manner, but we always do tell our professionals, our families, our patients that we are not crisis-based. So we will try to operate in a timely manner, but always, if we see that someone is in crisis or needing that support, we will refer them where they can be stabilized. And then once they're stable, they can access our program. With our psychiatry, we do not offer long-term longitudinal care. It works more as a consultation piece with the goal to always bring back the services to the community. So if you can show the next slide. Thank you so much. So this is, again, an overview that's helpful to kind of see the difference between substance use and psychiatry. So substance use works from Monday to Friday, 9 to 5, and you can access this program if you are 12 years old or up. Again, we are very much about seeing the gray areas as well. We don't have, we try to really, like, if we see that someone that's like younger than 12 will benefit from accessing the program, we can definitely have a conversation, but the program is meant to support individuals of 12 years and up. Once again, offers consultation, assessment, diagnosis, care treatment, and some follow-up. There is withdrawal management and access to risk mitigation, as well as early introductions and maintenance. And then we have additional care to alcohol, substance use, commercial tobacco concerns. And there is that participation in ongoing wraparound care, collaboration with the people in the community and with the professionals in the community. So our doctors work with whatever goal the patient brings. So if the patient wants just to reduce a little bit of their substance use, that's kind of what we're going to work on. So we don't have any established that it needs to be abstinence or it needs to be harm reduction. We really kind of work with whatever the patient wants and whatever that journey looks like. In terms of psychiatry, so that's also a Monday to Friday services, and we have psychiatrists from 10 a.m. to 3 p.m. So we only have one psychiatrist at a time, and it's limited because it's more specialized program. And then for this, you have to be 16 years or older. And again, we have some capacity if you are younger, but this will have to be a discussion and some consultation within the program to be able to see if we can support the needs of someone younger. And once again, this provides consultation, assessment, diagnosis, care treatment, planning, and follow-up. It also provides some concurrent disorder management. And with psychiatry, as opposed to substance use, we only provide short-term consultation. So often it's a one-time appointment with the psychiatrist to do the assessment, the diagnosis, and then the psychiatrist will want to send all the care and all of that back to community. Sometimes at the discretion of the psychiatrist, they might offer 1 to 2 follow-up appointments, maybe 3, but that's not usually the case. They're able to prescribe, evaluate medication, and they're able to provide connection and referrals to other mental health services as appropriate. Yeah. Thank you so much, John. And so part of providing this safe environment for people to access primary care, we have our MOAs, we have our doctors, and then we also have our care coordinators. So the care coordinators really work to help patients and professionals at times navigate the system. So the mental health system can be a bit overwhelming at times. Too many people, too many programs. Sometimes, we don't know kind of where to go. So it's someone that can be attached to the patient and help them navigate not only our service, but maybe locate resources in people's communities, sometimes advocating. So when a person accesses the program and it's been identified that our care coordinator could benefit from connecting with the patient, we've done things as like locating counseling, providing advocacy, providing education about what a psychiatrist does, what a psychologist will do, what a counselor will do. We also connect with local physicians and connect to case managers. Sometimes we're able to connect individuals to primary care clinics in their communities by calling the clinic, putting them on a wait list. And then really kind of identify any support related to social determinants of health. So that can be housing, income, education. We are able to provide limited wellness checks if this has been asked by one of our doctors. So we do have a background on mental health, and we're able to provide some of that. And part of our job as well is to provide webinars to professionals in communities so they are aware of our program, how to access. And also then you have a contact moving forward on if you have any other specific questions regarding our program. And with that, we're going to talk a little bit about cultural safety. So John is going to tell us a little bit about how cultural safety is embedded in a virtual service. Thank you.
Great, thanks, Laura. Yeah, so it might be a little bit preaching to the choir, if you will, around this topic with the Health Directors Association here and the health directors on the line, but really just to reiterate with the audience that these two clinics are rooted in that approach of cultural safety and humility. So a few bullet points here. We have a safe spaces protocol initiated with the clinic. So when somebody calls in and we do an intake with the program, we run through them what they're expecting out of that encounter with the doctor, and maybe if there's a way that we can make the space feel safer for them. Some of them don't want their cameras on. Some of them don't want certain questions to be asked. Some of them may not want certain topics to be covered in their encounter. We work with them on the intake to help identify what that looks like for them and what that feels like, more importantly, and how they can feel safe coming into that space. So our doctors are really in tune with our approach and with how we bring that protocol into action. We provide some education opportunities for our staff. So some of the providers, of course, they've all done the PHSA SANYAS training, which is great, but there's other avenues and ways in which they can reach out to each other or learn from different webinars or different education opportunities. We were hosting community of practice meetings with providers. So that's, again, working with them with that anti-racism in a virtual space sort of topic. And that was facilitated with somebody, and we're looking at reinitiating that opportunity in next fiscal year as we're introducing the topics to providers. We have a sound complaints and compliments process whereby any client of the service can reach out to us directly and really share with us what their experience was like. So whether it be a good one or a not so good one, we want to hear that, and we track that, and we ensure that we're following through with those with that feedback from the client. So if somebody said, I didn't appreciate how that doctor spoke to me in that way, I'd like an apology. I didn't appreciate the way I felt rushed in that way. we work with them to bring that doctor to that space and hold them to account in that regard. So it really is holding up the client and ensuring that that space is safe and is accountable to the clients. And so that's that piece. Of course, within the FNHDA website, we do have our cultural safety and humility section here where we have our commitments and we have the pledges. And so our team, our medical office assistants and our care coordinators have taken that pledge and have actually stepped into that and really shown, exemplified what that means for them personally and how they show up into that space. Really proud of Laura, who's on the call right now. I mean, she's gone over and above her role to really ensure that that safe space is held with each client that she works with. And I can say that for each and every one of these staff members, that it's an honor to be working alongside such caring, empathetic, understanding staff. And it's really energizing for me to be a part of that work. And so there's a few videos here that I wanted to share with folks around how we introduce that safe space into the program. So this video that I'm about to share is a video link that we sent to each client who has confirmed an appointment with our Doctor of the Day program. And I'll look for Laura's video to give me a thumbs up if we can hear the audio. I'm just going to click play.
Kayachtan, I welcome you today. In Squamish language I shared with you. I'm Sequalia Ann Wanick from the Squamish Nation, a knowledge carrier and elder advisor to the Doctor of the Day program. And I'm really honored to be able to welcome you here today to your appointment with the virtual doctor and to be able to share that you're going to be treated respectfully and properly and given that care that you need now until the time when you can go back to your family doctor, and that they will make sure and follow up during the time that they work with you, and then after share the information back to your family doctor. You need to know that they care about you and that they will do all that they can to make sure that you get what you need for your treatment, and to be able to chen stwite, stand and work together to hold each other up and help each other through this new way of being able to take care of you and your health in a good way. Tama kwetsi snachum, those are my words. Wachayap yo, you take care.
And so that video is shared with each client who has confirmed an appointment, and an email confirmation is sent out to them. It's a private video, so folks can't just access it publicly or see it. It's really sent directly to the client so that they can have that time and space with Sequalia. And two more videos I was going to share. I might just go through one of them, but we have some patient testimonial videos that have been that we worked alongside our communications department to really capture the voice of the clients who have been a part of this program. And so I'll just play this one.
How I first found out about Doctor of the Day was through my mother. I was actually sick and I was in bed, and it was probably a 2-month wait to even get a phone call. Talking virtually and online, it seemed to be a lot easier. The Doctor of the Day actually had called the hospital and arranged a lot for me as well. So they were really helpful. They went above and beyond. So it was really, really good. Made me feel really safe also. I felt like I was in a safe environment at my house too, calling, talking about my problems, and can share and express and talk about my stuff without being judged or anything like that as well. And I thought that was really good because I've had that up at the hospital a few times, and it's really, really not a fun experience. So because I'm a very active guy and I'm really avid with outdoors and all my hobbies, like I do outrigger and canoe pulling and stuff like that, and I found that it was really hard for me just waiting for something as simple as like an iron deficiency. And they decided to order more stuff to kind of eliminate what it could be. So I thought that was really helpful. But they really investigated a lot more and asked more questions and how long things were going on. And they seemed to really care for me. And we were chatting for maybe about 45 minutes or so. So it was a good one. Yeah, it was a really, really good experience. The thing I liked best about the service is that it was so easy to use and it was just fast, quick, and interactive, and I'm getting my results so much faster, and it seems to help out a lot more as well because they communicate with my family doctor too. So it seems like I have a lot more care now as well with different opinions from 2 doctors too. She reassured me that she was going to be there for me as well too, which I thought was really good. The whole process of it actually kind of just blew my mind with how quick everything has gone, and I'm just getting blood work, everything that I've needed, and it felt like I've been just dragging along and taking a long time. And yeah, I don't know, it's just a really good service. I would definitely recommend Doctor of the Day to anyone. It's just so much easier, especially if you're having issues with getting in with your family doctor or anything like that. I found that it was really, really easy. They almost did all the work for me. I just had called and they put in almost all the work and effort for me and made it seem so much easier. And it was such an easy process, and it was hard for me to figure out, you know, calling doctors, waiting for 45 minutes just to even get an answer saying you're gonna be waiting 2 months to talk. And it was just such a breeze, is all I can say. It's just the fact of not being so frustrated, having to call here, call there, trying to get in here or whatever. Like it was just, it was easy. It was really good.
Great. So, I mean, I might just share the one video, but really in that reflection from Bobby, you hear him say it was a safe experience, and I've had an unsafe experience up at the hospital, and it didn't feel very good. I think everybody here on the line, including myself, know exactly what he means when he says that, and which hospital and where he has experienced that, and really what that means for his own health, for his own well-being, and for what that meant for his care going forward if he felt hesitant about going into the hospital and feeling judged or encountering any racism. So there's another video, but I'm just I'm cognizant of the time, and so I know we have a 1 or 2 slides here, and I want to leave some time for questions too. So we have the website obviously for any more information around our Doctor of the Day program. And these will be links that Laura and I will share afterwards, but here's where most of the information can be found, as well as some more resources. So that's the presentation, and we do have some frequently asked questions that we have geared up, but I'll pause there and sort of see if there's any questions. Lucille, I see you have a question. Okay. Did you say we could access these videos? This would be helpful to share with our communications department. Absolutely. The patient testimonial video, you can, and I'll send you the direct link to Sequalia's blessing as well.
Hi, John, your mic is off.
I'm just nodding. I don't know. I'm
okay.
Not saying anything. I'm just agreeing with the group.
So a quick question I had there was, John, and Laura, in your presentation for psychiatrists, is this a referral process that our NADEC counselors or our mental health counselors can do some referrals to as well? If so, would you be emailing us that referral package? Thank you.
Yes, so counselors, again, anyone that's a professional in the community can make a referral directly to our program. I can definitely send you the referral form. Usually what happens is the referral form gets sent to the MOAs, and the MOAs will kind of screen it and then decide if there is an intake for care coordinators to do. And so our care coordinator will meet with your counselor, and we will kind of decide how to move forward with the referral. So we never want to make the decision alone. We never want to just get a referral and be like, yes, no, and then decide. We don't know anything about the patient or, kind of where they're coming from. So we want to have those conversations with the referral agent and then decide. So I can definitely send, as part of our package that we will be sending at the end of this presentation, I can send the referral form so that your counselors have access to that as well.
So at this time, if you, the health directors in the room, if you have any questions, feel free to raise your hands in the chat. I recognize that some are joining. Yes, the PowerPoints will be shared with all of us via email, and the links will be in the PowerPoint. And correct me if I'm wrong, Laura and John, if the attachment would also have the referral forms for the psychiatric supports. So I have a follow-up question in terms of the doctors. Have any of the doctors, how do the doctors give their feedback on how this is working? And because typically they don't do a follow-up with a patient. So how do they feel about doing this form of Doctor of the Day?
Yeah, so we do have monthly provider meetings with the physicians, all the physicians in our programs, and so we have that feedback loop with them to see how they're doing. So, sorry, did you say that? So we do provide some follow-up care. Really, the doctors are there as long as you're not getting access to your family doctor. If maybe you don't have a family doctor, you can think of it as a walk-in clinic. And certainly we have folks dialing in asking for a certain doctor they saw last time, or any of those pieces. We have a medical record system on our end where we're documenting a lot of those pieces. And so all that information is sort of held if folks dial back in. So.
I have a question for you, Charlene. So to send the package, should I send that to you or to Karen, and then you'll be able to redistribute that? Because I just realized I don't have her one email. So send it to you?
I would send it to Karen, and she
Karen.
can mass email to all of us.
Amazing. Thank you.
Thank you. So the other question I have for John and Laura, with this, the Doctor of the Day, statistically, how many, what did that look like? Is it success? Is it a struggle? And is there a long wait period for, if I phone in, would I be getting a call the next day?
For the Doctor of the Day program, we're looking at about 1 to 2 day wait period now. We're definitely running a line of, originally in the early days, we definitely had same day service, certainly same hour service. But we're province-wide, we're ramping up pretty quickly with a number of providers. So the program has been immensely successful in terms of the encounter numbers that we've seen across the past 1.5 to 2 years. And it's just been an exponential curve with folks dialing in. So we're working on our end to sort of streamline things and ensure that we can have the time and space for everybody to access the program. And so, yeah. Any feedback is greatly appreciated, and certainly from the powers that be as we advocate for more, if it's a value to folks. So.
I think I can say it's been pretty successful. Just kind of, you can look at the numbers, people accessing the service, people coming back, wanting to continue seeing our doctors, despite that conversation of connecting them back to resources in community. So I think, yeah, just given the business of the pathways, I can say, yeah, that people are happy with our services, the majority.
Hello, everybody. Just more of an inquiry. I know that the service is good overall. I've used it myself. I've had some trouble at some points, but it wasn't enough that could be fixed, which has been helpful. I'm curious what you mentioned just seconds ago was around the amount of people accessing it. I'm kind of curious about that. What are the numbers like in terms of people accessing this service? Where is the most usage in terms of DOD, in terms of the psychiatry, so the two separates? I'm curious about that, and it kind of gives me an idea. Is my area have a gap that people aren't utilizing it? I know that where I'm working now I'm doing my best to figure out how to support a community that's within a city. I think that again, as health directors know, at times you think, or people assume that people within a city have easy access to healthcare, mental health care, but that's not always the case. There's always barriers, and one of the barriers is that assumption. So it makes me curious. I think the other barrier is those that are away from home, and I think that's a huge barrier in terms of communication, and it's how to find out that information. I know that I've been able to share the information with people that have been, when not being a health director, just to say, try the doctor of the day, and they were quite surprised. They hadn't heard about it at all. And I think that's a communication gap. Thank you.
Yeah, thanks, Charlie. You can restart record. Yeah, sorry, apologies. I think, yeah, the thought is around that data piece is we could, I don't know what that looks like in terms of like a linkage between FNHDA and FNHA, but happy to explore that. We have things sort of waiting on the wayside. So yeah, just being cognizant of like community data and governance and ownership. Yep.
But also just to follow up on when you mentioned, Charles, of communication, we know we have quite a bit of work to kind of get out there and let everyone know. I think a lot of people are aware of the program and a lot of people are accessing it, but we can always do better, right? We're always improving. So if you have any ideas, if you want us to speak to a specific group, we are always open to come, and present in this way to communities, to anyone that you feel like they need this information and they need to learn how to access and the benefits of seeing someone virtual versus in person. So please do reach out if you need that for your community as well.
So each day, so thanks, Margot. Each day we will have 5 doctors on any given day. And so they're within each region. So for Vancouver Island, you will have 1 doctor. Well, it'll be 1 in the morning, 1 in the afternoon. Sometimes it's the same doctor, but think about it. Across the province, we would have 5 doctors online ready to go. And with each encounter averaging about between a half hour and an hour. Yeah.
John, you have a question from Margot in the chat. I think he captured that. Sorry, Margot. But one psychologist for the whole province. Did I hear that correctly?
1 psychiatrist, yeah, and from the 10 to 3 o'clock time slot, 1 per day. And recognizing so theoretically 3 pathways. So the doctor of the day, talking about maybe a 1 to 2 day wait list. Substance use, maybe a 1 to 2 week wait list, and then psychiatry, we're looking at 4 to 6 weeks. So, yeah. Okay,
that's good to know, because here in the Terrace area, we don't have access to the one that we used to connect that did private practice. So question I have is, how will this service be ongoing after COVID's gonna, it's not gonna end, but
will it's done today.
Your mouth to God's ears.
Yeah.
So will this be ongoing, or is this just for the pandemic?
No, so it was stood up in the pandemic, but there's definitely the funding is available to keep this going. And so, I mean, in terms of longevity, I'm around for, I'm not going anywhere. But yeah, that might be an FNHA question as to locking it for permanency or what that looks like. So.
And you do have a question in the chat, John, from Margot. Have you
Yeah, and then
considered-
even Lynn. Yeah.
Sorry,
so we've
Lynn,
got,
I didn't see that.
nope, it's perfect. So Lynn, physician number of patients they see per day. So with each encounter being between a half hour and an hour, and each shift being 4 hours in the morning and 4 hours in the afternoon, you can think of maybe 16 patients per region per day max. And so that's for doctor of the day, and then it's different for substance use and different for psychiatry. And then Margot, your question around nurse practitioners, yes, we've definitely explored what that looks like, having NPs on board, but I think there's nuances there around having a medical affairs office and medical oversight for those NPs. So.
Hello. I'm curious. I'm just more curious around the structure of all this, where the physicians are actually located. Are they all located within the Vancouver coastal area, or are they around the province? And if they are, what's the relationship like with the Doctor of the Day program and the health authorities, or the Doctor of the Day program and the Division of Family Practices?
Good question. So with each physician that we have, they're across the province, and the way we've structured it is wherever that physician is located. So say Vancouver Island, if we had somebody located in Nanaimo, they would be linked up possibly with their local hospital or with their local private clinic or what have you. They're within that health authority already. So the thought is that they only see folks within the Vancouver Island Health Authority anyways. So that's how scheduling works with those. So same with somebody from the north or somebody from Vancouver Coastal or similarly. So that's how, yeah, we have docs across the province, 43 on my last count, and each of them located across each region. So.
Charles, I'd just like to share with you, I sit with Change BC here in the Northwest, and with our primary care network with the doctors. They appreciate the support that their clients are accessing Doctor of the Day, because the information is uploaded to their file. So then the doctor, when they do get through to their doctor, they know that they've been managing rather than not seeing anybody. So the feedback I've heard has been very positive. And with Terrace area, Terrace is the hub of coming in the Northwest here. And with the doctor shortage, we do find having the Doctor of the Day program has been very supportive of our community members and those members that live off reserve, who've been struggling to even get a doctor. We've been able to connect them. So I just felt I need to share the feedback I've heard from the doctors from the Terrace area. Good question though, Charles. Thank you.
Thank you.
And to that extent, like in terms of data requests and things, like the divisions and some of the PCIs and other projects have asked us for data, and we need to tell them straight up apologies, but this goes back to the nation depending on which data you're asking for. And we're not here to overstep or overreach those boundaries. So yeah.
Is there any follow up on the second part of that question? Was around
Sorry, did I miss that? What was the second part? Sorry.
It was around the relationship with the health authorities, with DOD, and with the Division of Family Practices?
Yeah, really, I mean, specifically the program and each region. Yeah, I mean, so we have a close working relationship with Northern Health, who supports us with our physician contracts. And so the structure with each health authority, we have linkages with each of them, but it's really on a senior leadership basis where they would connect and have those conversations if there's any feedback or input. But the doctors themselves, they working within each health authority, they're there to help liaise some of those discussions. So. And then Judy, I guess I'd have to look into the data again to get an exact number to report back. But yeah, don't think I can answer that right now. So.
Thank you.
So I have another question. I just had an aha moment. With First Nations Health Authority, are they looking at other opportunities to have, let's say, some counseling support via I recognize some of the treatment centers are offering Zoom for members to participate via long distance. FNHDA looking at something like that down the road?
For sure. So we've actually posted a position for a counselor to be included with the program. And so we're currently recruiting for that position and what that looks like in terms of our workflows and supports. I think, yeah, and I'll just leave it at that.
Okay, thank you, John. I'm sorry, I didn't hear your response to, I believe it was Margot's question regarding the NP. I didn't hear your response, sorry.
Yeah, so definitely we've considered nurse practitioners and having them involved with the program, but I think the medical oversight is still a little piece that we would need to navigate and what that looks like. So.
Do we have any other questions from anybody? We have time. No more questions? Okay, so I'll confirm that we are recording the webinar. I know we had a few health directors that joined us late. And we will upload the recording up to the FNHDA website, and also confirming, John, that the PowerPoint we'll be able to share the PowerPoint. Perfect. Okay.
Absolutely, yes.
At this time, I will turn it back to Charlene, who just turned her camera off, and she will close our meeting in a good way. But thank you, everybody. Again, I know it's a busy time, so we really appreciate you taking the time out to join us today. This very important topic and service that FNHA provides to communities.
Okay, thank you. I wanted to sneeze there, but I couldn't. Father God, Creator, grandfathers, grandmothers, thank you for bringing us together. We ask for special blessings for all those fighting COVID. We ask that you give strength to the families of our loved ones in the hospital, for all the travelers that they may get home safely, for all the work that our staff have been doing to support our communities during this double pandemic. We ask, Lord, that you watch over each and every one of us, that the day and the journey that we travel may be a healing heart along the way. And thank you for this beautiful day that we have before us. In Jesus' name I pray, amen.